one of the things that's always so interesting is that we as a community, I don't think, do a good enough job letting everybody know what kind of options there are for care, and how to pay for those different levels of care. So definitely want to start off with in-home care. We all want to stay home. And for most of us, it's possible. Now, there's definitely times where it becomes unsafe or it's not appropriate anymore, and we have to look at some sort of placement in a facility, which we'll talk about also. But I always like to spend a few minutes talking about what kind of in-home care options are there. So as far as in-home care, this would be having somebody come into your home to provide various levels. So that can be nursing services, home health aides that can do things such as bathing, dressing, grooming, toileting, transfers, ambulation, some respite, some supervision, medication management. Now, a lot of time, those services really are considered private pay. So essentially, you are privately paying out of your pocket for those caregivers. So that can look a couple different ways. We see a lot of people that have a family member, a neighbor, somebody from their church that they can have come into their home to help pay to provide those services. Usually that's a more cost-effective way to handle it, because you may be able to pay that person $10 an hour versus looking at an agency coming in, which they provide wonderful services, but you may be looking at $20 or $25 an hour for an agency to come into your home. There are some ways to help supplement and pay for that care. And one of those ways is through veterans benefits. So if you yourself are a veteran or your spouse is a veteran, you may be eligible for a pension or even a compensation to help pay for some of that care. So there's some criteria that would go along with that: asset, income. Medically, as long as you're age 65 or older, you medically meet the criteria for that. Now, veterans pension benefit won't pay for all of your care typically, but it can pay for a big chunk, really depending on how much you need. So your pension could be $2,000 a month potentially to help pay for in-home care. Another great resource to help pay for in-home care is long-term care insurance. Long-term care insurance is a great benefit. It's not appropriate for everybody though. So I always like to mention, if you do have long-term care insurance, please, please, please look at your policy and know and understand what it actually gives you and provides for you. There's a lot of different things to look at. One, what does it cover? Does it cover in-home care? Does it cover a nursing home, assisted living? What all is included with that? What's the daily benefit that it's going to provide? We see a lot of really old policies that provide $100 a day in care. Now, in 1980, that may have been enough, $100 a day to pay for care, but now at the average cost about $350 a day, it might not be enough. You also want to look at your premium. Premiums get really tricky with long-term care insurance. So making sure, does the premium still make sense for you to pay, or are there other options? Now, Tammy and I would probably never tell you to just stop paying on your long-term care insurance policy, because we do sometimes get that question. However, there may be some options on ways you can convert that policy into something that makes a little bit more sense for you. So if you have a long-term care insurance policy, definitely look at it. Make sure it covers in-home care, nursing care, whatever you might want or need in the future. And also to spend some time looking at what the benefits are with that policy. That can be a great way to help supplement for in-home care. Another way, and this is something Tammy and I both have a lot of experience with, is there are benefits through the Medicaid waiver programs. So this is really the only option to get the care paid for in home for you. So it's a Medicaid program. So there are really strict income and asset guidelines. So for any of you that have listened to any of our seminars before, we really dive in deep to what those income and asset guidelines are. Keep in mind, just because you think, or you may have been told, that you don't necessarily qualify financially based on your income or assets for the aging waiver program, there's almost always ways around that. That's what Tammy and I do every single day, is work with families. we get a lot of referrals from the Office of Aging that say, hey, so-and-so called us, they don't qualify, can you help them to get qualified because they really need this care? That's what we do. Now, some really important things to know with the Aging Waiver Program, I guess now it's the Community Health Choices Waiver Program. They keep changing the names on us. It does provide in-home care that's paid for by Medicaid, the state. However, it's not going to be 24-hour-a-day care. We've really seen a lot of variation in how much care that's being provided. I know years ago when I worked at the Office of Aging, maybe 5 hours a day. And then it kind of went up and up and up and up. And I was getting people with a lot of hours a day. But now we're on the down, we're going back down now. So if your loved one really needs 24-hour-a-day care to stay home and you can't supplement that care, it might not be the best option for you because we might be looking at safety issues or other concerns. Another thing to note with the Aging Waiver Program is that it doesn't provide skilled services. So it's not going to provide nursing or somebody to help with medication management, but it can provide things such as supports with like toileting, bathing, dressing, grooming, light housekeeping, meal support, some supervision, some respite, things like that. So a lot of times this program's really appropriate if there's somebody else living in the house. So a spousal situation that just needs a little extra help to keep their husband or wife home. Or and if you live with your parent and maybe you're working during the day and you need somebody to come in and help. I always look at the Aging Waiver Program as kind of one of the last options to be able to try to keep your loved one home unless you can private pay around the clock for care. So a lot of times, and I know Tammy's in the same boat, I get asked, well, does it make sense to even do this? Or, I don't want to place my loved one, but should we go through this process? And I always say yes, because if at that point, if it's not enough care, you know that you've done everything you possibly can to try to keep your loved one home. And guess what? Then we've also got the Medicaid qualification already. So it's a nice, easy transition into the nursing home, which Tammy's going to talk a little bit about how that works as well. So for the in-home care, there's definitely those couple options. Now, one other thing I just want to mention is if you find yourself in a situation where you're paying somebody that's not an agency to come in and provide care, so a family member, a neighbor, whoever that may be, it's really important to put a care agreement in place. So that's something like Tammy and I do all the time in our office. It's a very, simple legal document, but it protects you from Medicaid benefits in the future. What we've seen happen is families that are paying somebody to provide care for their loved ones, and then they need Medicaid benefits for either in-home or nursing home care. Without some sort of written agreement in place, the state of Pennsylvania might look at those payments as gifts because they can't prove that they actually were going to pay Jane to provide care for your husband or your wife. We're going to dive more into gifting and how that all works together. But I always just like to mention, if we're talking about in-home care, it's really important to make sure that you have some sort of agreement in place if you're not with an agency. Okay, I'm going to dive into independent living here.
And Kristin, just
real
quick, like some of the in-home care agencies that maybe we've worked with that, are there like home watch caregivers or home instead? Are they some of the different ones that we've worked with in the past?
Yeah, there's a lot of different agencies out there. So it doesn't hurt to shop around. These people are going to be coming into your home. So you need to make sure you're comfortable and you understand what's going to happen when they come into your home. These agencies want your business. So if you don't be afraid to say, well, Jane came into my house through Home Instead and we just didn't mesh. It didn't work out well. Tell them that. They're going to find somebody else to come into your house. If it doesn't work out, there's other agencies out there. There's some agencies that are small, so maybe there's just one office that's going to maybe just service the Williamsport office. And there might be other agencies that are big corporations and they have offices all over the state or even country. It's also important, I'm glad you brought that up, Kyle, because not every agency is going to have a contract with the Medicaid waiver programs either. So that's up to them because, you know, the reimbursement rate's a little bit different than private pay. So some of them decide not to actually hold contracts with the waiver programs. So for instance, I can say Comfort Keepers. Comfort Keepers out of our Williamsport office in Lycoming County, they do contract with the waiver programs, right, Tammy? Are they still? They're not anymore.
No.
Okay. I was gonna say, because I know State College actually stopped. And I know one thing with State College is, and it must be trickling down to our Lycoming County office too, is the amount of care and the cost of care and the cost of reimbursement, it doesn't actually pay them to be enrolled in that program. I think we're going to unfortunately see more agencies feeling the effects of that because they have to pay their caregivers more. So those are some things to be, you know, be aware of. But at the end of the day, knowing that there's options for in-home care is really important. And, you know, Tammy, I get phone calls all the time. We were told that we don't qualify or because of X, Y, Z. And the good news is you most likely do qualify. There's options. There's ways that we can look into things and figure out a plan that makes sense for you. All right. So independent living. This is just a little sliver. So independent living is really a place where you would move into. So it's usually part of some sort of community where you're really just living there. So maybe it's apartments or townhouses. It can be part of a bigger complex. So maybe it's a facility that has different levels of care. Maybe it's an independent. So it basically you're moving in to this type of independent living and you're paying your rent. And there might also be a buy-in, which we're going to talk a little bit more about continuing care retirement communities and how that all falls into this as well. But independent living is really just kind of that first stage. So maybe you just you can't stay in your house anymore because it's too much to maintain your lawn work and you know, you're not driving anymore, whatever the situation may be. A lot of times we see it as a stepping stone to, you know, getting ready for when you need a little bit more care. Often we also are dealing with independent living in a spousal situation where one spouse may need a little bit more care, maybe like a personal care or a skilled nursing, and the husband and wife that doesn't need that higher level of care wants to move to the same facility as their spouse. So they're just more in the independent at that point in time. So we're going to touch more on that here when we talk about the CCRCs, the continuing care retirement communities, because that kind of plays a role there. But before we get into all that, I want to turn it over to Tammy to talk a little bit about like the personal care homes, the skilled nursing, what those look like and how you pay for those.
So that's the next thing we're going to talk about is assisted living. Now they're also known as personal care homes. And in order to be classified as an assisted living, they have to meet certain licensing criteria. So you might see those names interchangeable, but the facilities are very similar in what they offer. So in an independent living, you are living without the support of the entity you're living in. You're taking care of yourself. They might offer one meal a day as part of you know, the fee that you pay on a monthly basis, but they're not providing any support services other than that. Yeah, whereas a personal care home / assisted living, what they're doing is they're offering a lot of support. So they're going to give you 24-hour nursing care. They're going to give you assistance with personal care on an as-needed basis. So most of the facilities are offering levels of care. So you may come in kind of independent, but you need help with medication management or you need meal preparation, but you can bathe and dress yourself. Well, the levels of care allow you to age in place. So as your needs increase, that you would pay a little bit more for an increase of services. So a personal care home / assisted living it is all private pay, and Pennsylvania is one of the states that have decided not to supplement that, and it's unfortunate because I worked in another state where people could stay in assisted living rather than go to nursing homes. And it was a fantastic way to age in place. But Pennsylvania has opted not to do that, unfortunately. So the assisted living personal care homes are an all private pay situation, which if you do not have the resources to live there, you can't live there. And unfortunately, what we find sometimes is that people are really in between. So they're not independent, they're not assisted living, and they're not quite skilled nursing. So it's a real challenge sometimes to work with the systems to make sure that somebody is safe. But the private pay would be a range of anywhere from $3,500 per month to about $7,000 to $8,000 per month, depending on the area you're in. So I think, Kristin, you find in the state college area, it's upwards to $8,000, maybe even $10,000 a month. Yeah. Whereas in Lycoming County, I'm seeing the average between $3,500 to $7,000 a month. So if your income is only $2,000 a month, you've got to have the resources to supplement that. If you don't have the resources to supplement that, again, long-term care insurance, if you purchase that before your medical need, that would be an available resource to help pay. And then again, veterans benefits, like Kristin talked about for in-home care, that's also a great resource for somebody who needs to live in an assisted living, because the monthly pension that you would receive can really offset the cost of care. So again, those are things that Kristin and I help people explore every day when they're thinking about, where am I going to live? What can I afford? What benefits are available to help me with all of that? In addition to that, there's something new that's really cropped up in the last, I'd say, 5 to 10 years, and that is memory care facilities. And these are just fantastic facilities, because people that suffer from a cognitive impairment may still be able to function physically, and it's not always appropriate for them to live in a skilled nursing facility. It just really kind of takes away all of their quality of life when they still might have some great quality of life. And so these memory care facilities are also personal care homes / assisted living. But the thing that they really offer is a secured unit, so that your loved one can go there. You don't have to worry about them walking out the door into traffic or getting lost. It's secure, locked, so that they have the ability to really roam around and explore their environment. We just had one open up here in Lycoming County not too long ago, Heritage Springs. And that's in Muncie. And then the Hillside actually just renovated their whole downstairs into several memory care rooms. And so we're really excited about these two locked units, because the other assisted living facilities have always taken people with memory issues, but they straight out explained that they can't offer security if somebody is a wander risk or flight risk. And that is very dangerous to somebody to be in that kind of situation. And what's really nice is, again, they're offering that aging in place. So, if somebody's cognitive situation develops to the point where now they really need a lot of physical help as well as cognitive supervision or guidance, they're offering that support service there. So the goal of any assisted living facility is to try to keep people out of a nursing home as long as possible. But there's always medical situations that arise that might require them to need nursing home. And if that facility can't provide a safe environment for them, or they become bed bound and it's a long-term need versus a hospice situation, then that's really where skilled nursing is appropriate. So we talked about independent living. You're pretty much on your own. They might give you a meal, might offer some amenities like, transportation, or a store like the Williamsport home. Independent living has a little store, so you don't have to drive out in the winter, so things like that. But what the assisted living offers is, in most situations, you have your own room, you have your own bathroom, you go to a dining room for your meals and snacks. You have access to activities and events. Unfortunately, probably not right now during COVID, but normally they have a number of activities to really keep you socializing with other people, which is very healthy. And again, you know, based on what your needs are, they would offer assistance with bathing, dressing, toileting, showering, all those, you know, things that you are going to need in order to function on a daily basis. The biggest thing they offer is a medication management. So, you know, somebody who's maybe getting confused about all those pills they're supposed to take, they're going to do that for them. So, you know, one of the things that Kristin and I often encourage people to do is to utilize assisted living facilities, not just for long-term placement, but for respite care or transition care. So if you had a hip fracture and you've been at rehab and they've been doing everything for you for 2 months, and now all of a sudden you got to go back home, and it's a pretty scary prospect because now all of a sudden you're doing everything for yourself. A good transition is to move to an assisted living temporarily, and all of the facilities we work with offer this kind of service where you can just move in for a month. And that way you're getting used to being more independent, but you have the support of that 24-hour care for low cost. So it might cost you $3,500 a month versus caregivers at home, which might be $15,000 a month if you needed to pay for 24-hour care. So those are some things that we utilize the assisted living facilities for. But also if family members are providing care and they need to go on vacation or they're sick, you know, those facilities often have empty rooms that they can offer a respite stay. And typically I'm finding that they want at least 1 to 2 weeks, not just a couple days, because there's a lot of paperwork involved in that. But that's a really great way to utilize those facilities. Now, pre-COVID, people were coming into our resource center to get brochures about all the different options that we're talking about today. But please feel free to reach out to Kristin or myself if you ever have any questions about any of these things, or Kyle, and we can gather the brochures on the home care agencies, the personal care homes, skilled nursing homes, so that you can take a look at them yourself and investigate what works best for you or people you might know. You know, another thing that's not in our category that we're talking about, but I just wanted to throw out there, is adult day services. So adult daycare programs are also really great for people who are in independent living or living at home, because what they do is they offer a respite to the primary caregiver. So it's a center that you would go to, you know, 1 day a week, 3 days a week, 5 days a week. The maximum is going to be 5 days a week. And the program that it offers is often, you know, meals, snacks, supervision, cueing, socialization. And it's really not just for people that have cognitive impairment, but we see most of the times that's the people that are utilizing the program. But it can also be physical impairment, or just somebody who's really dealing with isolation and they need a socialization. So it is a paid program, though. There's typically a daily amount that you pay. So in Muncie, Pennsylvania, we have an adult day program, Liberty, and you do pay per day, the days that you go. And then in Williamsport, we have a program called Albright Life, which is an adult day program, but it's really a comprehensive health program that offers all medical care. So when you sign up for this program, they take over all of your medical care, including your physician and everything. And that's a monthly amount you pay. I think it's a little under $5,000. Or they are enrolled in Medicaid. So if you're eligible for Medicaid, then you can, Medicaid would pay for that. So those are other options that we wanted to just make sure everybody's aware of. The final level of care before we talk about continuum care facilities is skilled nursing. Now, this is probably nothing new to any of you. Everybody knows what a nursing home is. You go in there because you can't live at home anymore. You can't live in a personal care home, and you need 24-hour care. So it's really, not only end-of-life care, but, you might be in there for years and years. My grandmother was in a dementia unit for well over 6 years in the nursing home. And I've seen, I had a client recently who was at 15 years in the nursing home before she passed away. I just couldn't believe it. But people are living longer in nursing homes. The average life expectancy years ago had been 3 to 5 years. And again, it depends on where you're at, what stage in your medical condition or your age when you do admitted to a nursing home. But, the average span, I think up at the Williamsport home is people are living well into their hundreds. And, so we can't think, I'm going to go into a nursing home and then die. That's not the case anymore. And nursing homes are held to very high standards by the state, and they have a number of criteria that they have to meet. So people are getting better care than they have in the past. And so that's really, extending their life expectancy in a nursing home. But the biggest thing to be aware of, and this is really where the pre-planning is so valuable that we do here at the law firm, because nursing homes are private pay, and they're the most expensive form of care that you're ever going to pay for. So the cost is going to be an average of $9,000 to $15,000 a month. That covers your room and board, but it does not cover your medication, supplies, medical expenses. So there's just a number of things to be aware of. And if you have money, you have to pay. If you don't have money, you could qualify for Medicaid. And what really we offer here is, I don't like to say loopholes, because the law actually has written within it allowances. But you have to be knowledgeable about how to take advantage of those allowances. The Medicaid office is not going to tell you. The nursing home will offer to fill out your application, but they are not trained specialists in this, nor do they have your best interest in mind. So yeah, you can avoid paying an attorney to do this, but you're going to end up paying more in the end than you would have ever paid for legal fees, and you're on your own. So I really discourage people from having the nursing home do that. And I'm not saying anything bad about the staff there, because we have a fantastic working relationship with them. And most of the time, nursing homes are thrilled to give us the job because it's hard work. It's very hard work. So even if you have money, the message I want you to understand is that we can help you. If you are married, we can help you protect almost everything. If you are single or widowed, we can help you protect about half of what you have. And these are all in situations where you have not pre-planned. If you have pre-planned, you make the decision in advance with us on what you choose to protect before the nursing home admission is needed. So again, love pre-planners. Kristin and I have had the opportunity, since we've been here so long, and helping people pre-plan that end up in crisis 5 years after we've done the pre-planning. And one of my favorite examples is a lady who came to me when she was 90, and she wanted to put her house in a trust. And her kids said, "You're crazy. You're not going to make it through 5 years. Why are you paying these guys to do this?" And she said, "I think I'll be fine." And she went to a nursing home at 96. So her house was protected. And then she had money outside of the house that was unprotected. And we helped her protect half of that. So it was kind of a neat hybrid where we did pre-planning and we did the crisis planning. And in the end, we helped her protect a lot. And it's not just for her children, because she's still alive in the nursing home. And when you're on Medicaid, they let you keep a measly $45 a month of your income. That's not enough for women to get their hair done or buy clothing or get, the personal things that they need. the thing for my client is that she has peace of mind that if she wants to go shopping with her children, she has money to do that and she's not putting a burden on them. So it's really there for that person. Now, again, they're not going to spend everything we've protected, so it will go to their beneficiaries, and the state of Pennsylvania will not be able to recuperate that. Now, some people say to me, are there ethical issues with this? And we all have to answer that question for ourselves. But in my opinion, they wrote these allowances within the law because the people that wrote the law are utilizing these allowances themselves. So keep that in mind. They're the representatives that we've appointed, and they are utilizing the same thing. And it's really just who has the foreknowledge of pre-planning. You know, so that's just something to keep in mind. But that's really what skilled nursing home is. And VA benefits that we touched on before, and long-term care insurance, those are also ways to pay for care. But like Kristin said, they're not going to be enough, because unless you have a super fantastic long-term care insurance that pays unlimited for your entire life, which they don't issue anymore, it's not going to be enough. You're always going to run out of money. And the VA maximum pension's a little over $2,000. So at $10,000 to $15,000 a month, you're going to be in an insufficient fund situation.